Hi friends, once again this is Dr. Nishitoza. I bring you greetings from Navi Mumbai, India. Today I'm going to talk about an important topic that is ultrasonography scans in pregnancy. How many, when and why, and little bit about the safety of ultrasonography in pregnancy. Let us talk about what is a screening test. A screening test is the one which is applied to the general population, which is apparently healthy individuals, to find out those who are at risk for a specific particular disorder, so that special counseling and care can be offered to these people. An ideal screening test should be easily available, affordable, sensitive, specific, simple, non-invasive, that is safe. Friends, ultrasonography today satisfies most of these criteria of an ideal screening tool in pregnancy. How many scans should be performed in pregnancy? Friends, there is general consensus about two scans in pregnancy. That is, one 11 to 14 week scan, which is called as NT scan, and the other one 18 to 22 week scan, which is also called as anomaly scan. So does it mean that apart from these two scans, one should not perform any other scan? No, it is not so. It will depend upon the history, examination findings, or the risk factor in particular woman, which may dictate to perform additional sonography scans. In general, in first trimester of pregnancy, one may require to perform sonography scan in about 20% of women. In early third trimester, 20% of women, and in late third trimester, 15% of pregnant women may require to undergo ultrasonography scan. Let's start from the beginning. Say in the first trimester, say 6 to 9 weeks, or maybe 9 to 11 weeks. Here again, it will be dictated by history, examination findings, or risk factor indicated. 1 out of 6 pregnancies may end up with a miscarriage. So if there is a history of bleeding in early pregnancy, one may require to do sonography scan. 1 out of 100 women may have ectopic pregnancy, and therefore if there is history of bleeding and pain in early pregnancy, one may require to do sonography scan. In a woman who has conceived with the help of infertility treatment or artificial reproductive technology, one has to do sonography scan to rule out multifetal pregnancy, that means twins or triplets. And if found, one has to determine the chorionicity, which will be important for prognosis and management of this particular patient. Now, 11 to 13.6 week scan, which is called as NT scan. What is the purpose of this scan? To screen for aneuploidy, that is trisomy 21, 18, 13, Down syndrome, Edwards syndrome, Patau syndrome. Number 2, to screen for likelihood of developing preeclampsia. Number 3, to screen for likelihood of developing fetal growth restriction in future. Number 4, early assessment of the length of the cervix to determine those who are at risk of preterm delivery or incompetent cervix. And number 5, to detect in a small number of patients the congenital malformations in fetus. Maybe about 10 types of congenital malformations of fetus can be detected at this particular gestational age. And friends, there are criteria laid by Fetal Medicine Foundation which help you to have a proper NT scan performed at this particular stage. Next, 18 to 22 week scan, which is also called as anomaly scan. Friends, incidence of congenital malformations in pregnancy is around 2% in the general population. And ultrasonography can detect as many as 50 types of congenital malformations in this particular gestational age. The risk factor for congenital malformations are diabetes mellitus in pregnancy in the mother, also exposure to teratogen in early pregnancy, or infection in early pregnancy. But remember friends, 80 to 90% of congenital anomalies can occur without presence of any of these risk factors, and therefore this screening tool should be applied to the entire population to detect the abnormality. Here, what we do is we follow a systematic examination of anatomy of the fetus, maybe by ISOG guided 20 plus 2 planes approach, so that we do not miss out any part to be examined. Here, the incidence of congenital malformations is 2%, and therefore it is important to have proper time spent to detect the anomalies. A sort of checklist is prepared so that from head to toe all the structures are examined so that not to miss out any important finding. After this, in 22 to 24 weeks, very selected people may require to undergo fetal echocardiography when there is a history suggestive of fetus being at greater risk for congenital heart defect, or if one has suspected any finding during 18 to 22 weeks, which will dictate performance of fetal 2D echocardiography. Next, at 28 to 32 weeks, what one may advise is growth scan. It may be required in say 20% of the cases. Which are the cases? When a consultant finds that the symphysis pubis to fundal height is falling short of or less than expected during the according to the period of gestation or period of amenorrhea, in which case one suspects fetal growth restriction. Or in certain high risk cases like pregnancy with high blood pressure, pregnancy with diabetes mellitus, twin pregnancy, previous history of unexplained stillbirth, low-lying placenta, that is placenta previa. Remember, in an affected FGR case, one may require to perform sonography scans frequently, maybe every 2 to 3 weeks just in duration. Next, at 36 to 38 weeks of pregnancy, one may require in 15% of cases to perform sonography scan, which is mainly for fetal well-being. In this, we look at the fetal biophysical profile and obstetric color Doppler. Again, in high-risk cases with pregnancy with hypertension, pregnancy with diabetes mellitus, previous unexplained stillbirth, fetal growth restriction, and also in certain cases of previous LSCS where I would like to measure the scar thickness for helping in the management of the pregnant woman. So remember friends, remember three things. Ultrasonography today is an ideal screening tool during pregnancy, but one should use it at correct gestational age for the correct indication in the correct manner. Number two, anti-scan anomaly scan are the two most important and must scans for you. Number three, in other 20% of cases, additional scan may be indicated depending upon the history, examination, or the risk factor. And one more important frequently asked question, whether ultrasonography in pregnancy is safe to be performed in pregnancy. Here, today, sonography is considered to be, diagnostic ultrasound is considered to be safe for pregnant women. We only remember two things. One is LRA principle, that is as low as reasonably achievable. That means as minimum amount of duration and minimum amount of energy which will be safe for the pregnant woman. And two, before 10 weeks of pregnancy, avoid using high energy in the form of color Doppler. So if you remember this, then ultrasonography is quite safe. So friends, I hope this has clarified most of your doubts. Keep watching, update your knowledge, and put your comments and queries in the comment box. This video is also available in Hindi language on my Hindi channel. Hope to see you soon again. Thank you for watching this video. Thank you.